Welcome to Understanding the Canadian Triage and Acuity Scale course. This is a quick run through to familiarize you with what we call the CTAS. This is a system that is used within Canada by EMS, by 911 dispatchers, by search and rescue, life flight, even your local hospital, even your walk-in clinic, to decide who gets seen when, how do we categorize the people we do see, and how do we categorize the people that are coming into the facility to be seen. So there are 5 levels in your CTAS. It starts at level 1. Level 1 being considered the most acute, seen the quickest. These are the patients who are in the worst condition. And then it goes all the way down to level 5, which is seen as the least acute, seen last if possible. They don't require as much interventions nor attention to solve what they have going on at this moment. So level 1 is labeled resuscitation. Level 2 is labeled emergent. Level 3 is labeled urgent. Level 4 is labeled less urgent. And level 5 is non-urgent. So worst goes first and best for last. To help kind of break this down a little bit more for ERs, they're color-coded and they also have time stamped to them. So that's not just a label, you're kind of giving everything a guide. Now these numbers are only in an ideal scenario where the hospital is completely empty, there are nobody in the waiting room, there's nobody around, and this particular type of patient is the only patient to be brought through that door. So your level 1 is blue. This is not by accident. You may hear on TV shows and movies that somebody's calling a code blue. That's kind of in coordination to this, in that your first level, your resuscitation level, is level 1 and needs to be seen immediately. So this patient needs some sort of resuscitative measure or else they will not make it. So therefore they are code blue, level 1. Now next up is your level 2. That's emergency level. They are to be seen within 15 minutes. They are color-coded red. Level 3 is yellow. It is urgency. They are ideally to be seen within 30 minutes of coming in through the door. Level 4 is less urgency. They are within 60 minutes. And then your last level, level 5, is white, non-urgency, to be seen within 120 minutes, 2 hours. So the person who meets this one, if they are coming through the door, they are to be seen ASAP if a room is available that can see them. And then if this person comes through, we know we have time, so we don't want to take up rooms. We'll sit them for a bit in case a level 4, 3, or 2 comes above them. So then what does this look like in the real world? So in the real world, this Snapchat is from the Health PEI website. It shows you exactly in real time how many patients are waiting to be seen and how many patients are being seen. So at the QEH, they break it into 3 groups. They have most urgent. This would be your level 1 and 2 CTAS. They have urgent. This is your level 3. And then less urgent. So your level 4 and 5s go here. Now you'll notice that the number of patients being treated by a physician is not broken down. This is actually Prince County Hospital. The reason that this isn't broken down further into these groups is because of privacy issues. So if you're ever curious why this number seems to be quite high or quite low, but the wait times don't make sense, so today it's 29, but everybody's an hour or 2 wait, even though they're urgent, we don't know what's making up that 29. So let's look at this again. So there's 2 patients who are in level 1 and 2, and they're still only going to be seen in an hour to 2 hours. And there's 7 people who have been categorized level 3. They're only going to be seen in 2 to 3 hours, and then 12 people in level 4 or 5, 6 to 7 hours. So based on this, we're looking at a hospital that has possible factors affecting their CTAS time. Resources, rooms available, patients already being seen, we don't know their levels, and resources being used on these patients. Summerside, while it has lower numbers in comparison and lower numbers being seen, has equal or worse times depending on which you're comparing, so 1 to 2 hours, less than 1 hour. This one 6 to 7 hours compared to 2 to 3, and then these 2 matched. So they have nobody in the most urgent, so if somebody comes in, they must have a room available waiting for that type of patient to come through. And therefore nobody in it from this 12. So what does the big CTAS look like? So we talked about the colors, your code blues all the way down to your white for weight. It can start as like cardiac arrest. These are quite small. This is why, and this is even everything. It's not all inclusive, but we'll break this down a little bit for you in a second. So this can be anybody from strokes, major traumas, cardiac arrests. Then you get that it's very exclusive. To get this level, there's very minimal things that count. Then your level 2s, you're looking at serious conditions. It starts to include more widespread, wide cast things. So something that's almost as bad as this, but not quite symptomatic possibly. Then you get your broad stroke in your middles. So this starts to get, the names are even broad to read. So just general abuse, neglect, or assault. Then you get into your level 4s, your 60 minutes. The times are here. The colors are all here again with the labels, with the numbers. Here you're getting into stuff that seems not quite as bad. They probably had a history of this before. They don't need to be seen quite right away. And then your level 5, which is your trauma, minor sprains and strains, minor symptomologies, and then more examples on the right-hand side. This is definitely not easy to see as the print is very small. If you Google the Canadian ED triage and acuity scale, you'll find many images of this, possibly broken down, that you can zoom in on and see exactly what this is involved in. So if you're ever wondering why you are being leveled 4 instead of level 2, this will help kind of guide you. So let's look at them with some kind of more clear-cut examples. So your CTAS level 1, your code blues, these are your resuscitation. See patient immediately. So as Summerside showed, they have nobody waiting, but if somebody came through, they're less than an hour. These are conditions that are actively threatening life or limb. So for example, you're looking at your cardiac arrests. You're looking at somebody who's in a pre-arrest symptomology, somebody whose return of spontaneous circulation, which means they had a cardiac arrest but have been brought back. Someone who's displaying active, violent, or homicidal behavior, which is seen as more rare than someone who has suicidal behavior. Someone who is unconscious and not yet able to be roused by any means. Somebody who is actively seizing and not able to have that stop by their own body or by the chemicals we've been giving them. Somebody who has major trauma, so you're thinking they will need to go to surgery. And somebody who's having a traumatic pregnancy event occur. So this is somebody who is too early to be delivering. They're going to have a preterm baby. Or they're on time, but we're seeing something like a prolapsed umbilical cord or an unusual presentation of the baby. So we know that they're going to need surgery for mom, if not mom and baby. Then we get to our CTAS level 2. This is your emergency label. These people should be seen within 15 minutes in an ideal world. They have a condition that has potential to threaten life or limb, but is not currently. That would be the difference between your 1s and 2s. 1s, it is threatening actively. Level 2 is, it's making the threat to do it. So you're looking here at chest pain with poor perfusion. Somebody with an altered level of consciousness, but is able to be roused by either pain or verbal. Someone who has attempted suicide or has a clear ideation, which is a fancy way of saying they have a plan. Someone who's got frostbite or severe hypothermia. Someone who is pregnant and in active labor. So for CTAS level 1, this was somebody who would be in active labor with a pregnancy that isn't a good time for this to happen, whether the presentation or the timing of it in their semesters. This person for a CTAS level 2 would be in the right semester at the right around their due date. Healthy baby, healthy mom, just need to get the baby out. Somebody who's had a stroke in the last 3.5 hours. And then somebody who's showing active shortness of breath, non-resolved. And that's with or without interventions. CTAS level 3 is urgency. These patients should be seen within 30 minutes. So they have a condition that could progress to a serious problem requiring interventions. Examples of this would be something like hypertension. So that would be hypertension that's either no longer being managed by their medication or has never required medication and is a new onset. Somebody who is vomiting blood. This could be for any reason and any amount of blood coming up through vomiting is a bad amount of blood. Somebody who has mild shortness of breath, and that's either with or without an intervention, but they're still able to communicate, they're just feeling tight in their chest. Somebody who's experiencing depression, somebody who is experiencing burns to 5 to 25% of body surface area, and somebody who has had a seizure but it's now resolved, and that's either through organic means of their own body stopping the seizure or EMS providing medications to have stopped the seizure. Level 4 is labeled less urgency. This patient is to be seen within 60 minutes. They have a condition that would benefit from an intervention or just general reassurance that everything is okay and what you're doing is fine. So these types of patients would have, for example, a potential for dehydration. So you're looking at somebody who maybe has had the flu, then maybe they've been having excessive sweating due to the heat, something like that, that you're like, yeah, you need some IV fluids. Patient who has constipation, the fear here is that it could develop into a bowel impaction. Somebody who has a UTI or urinary tract infection, with the worry being that it could develop into a full-blown UTI from their kidney right down to ureters. Somebody who has confusion, whether it's known or unknown cause, but they are awake, they can talk, and they don't need to be roused. They are completely awake. They're just confused. Somebody who's having symptomology of mild anxiety or agitation, so they are not depressed, they are not suicidal, they are not homicidal, their just mental health has been questioned. Or somebody that has a trauma on the level of laceration or puncture trauma that only would require stitches. So whatever happened to them is not large enough to need a full-blown surgical suite. It could be done with a couple stitches. And then last is non-urgency. This is a patient to be seen within 120 minutes. They are acute but non-urgent condition or a chronic condition that has possibly deteriorated but doesn't have to. They usually are a patient who could be referred elsewhere. What do we mean by elsewhere? We're talking about somewhere such as a walk-in clinic or family doc. Examples of this would be minor bites, general one-day diarrhea, wound dressing changes, sore throat, upper respiratory illness, that's your cold and flu kind of stuff, and then minor contusions, abrasions, or protrusions. So that's all of your CTAS levels. If you require a little more assistance, absolutely feel free to Google your CTAS. Feel free to look it up and on the website. There is a chart that'll help walk you through again. And if you have any questions, certainly reach out. Thank you. Bye.